Hi, this is Dr. Cash and Dr. Cash Medical and Life. Well, today I'm going to share with you a MRI and a CT scan of a spine, and I'll share a little background about the patient. Uh, Middle-aged lady, 55 years old, came in with feeling sick, sepsis, fever, found to have multiple abscesses in the lungs, and also positive blood culture for methicillin-resistant Staph aureus. And so we were pretty sure that the patient has endocarditis of some kind, no obvious skin lesions and such. And the blood culture kept becoming positive, and patient was treated for sepsis and MRSA bacteremia. And she was having some back pain, discomfort as well. So we went ahead and did CT scan MRI of the lumbar and thoracic spine, which the lumbar spine was okay. About 2 months prior to the very abnormal CT scan is this, and this is the MRI. This is a sagittal section splitting the person into half, and so this is the spine right here. Just for landmarks, the spine. This is the vertebrae. And this is the front, this is the back, this is the spinal cord right here. So these are the discs, vertebrae, disc, vertebrae. As you can see, the vertebrae are relatively maintained, okay? So as we looked, muscles and then going into the spinal cord here, there's some inflammation here around this area. And this is where the patient has some pain and discomfort here, but no obvious abscess was seen, so nothing was done in terms of surgical drainage or anything like that because there's nothing to drain. The recommendation at that time was to go ahead and do 8 weeks of antibiotics with close follow-up. So anyways, nice spinal cord down here with fluid, and but up here you can see that there's some inflammation here for sure, okay? And then the patient was recommended to go to skilled nursing home for a close follow-up and with IV antibiotics and close monitoring, imaging studies as required, but the patient insists on leaving the hospital. Patient does indeed have some history of polysubstance abuse, so her decision was rather impulsive, and so she left against medical advice, despite being seen by the psychiatrist, as well as multiple specialists' recommendation for consistent IV antibiotics with close follow-up MRI. Okay, nonetheless, at least at this point in time, the spine seems to be intact here, with some inflammation. Okay, now we'll be moving to take a look at the CT scan, which she presented about a little bit less than 2 months later with worsening of pain, and we'll see how they look like. So about 2 months, almost 2 months later, the patient was not feeling well, having fever, not feeling well, worsening of pain, and so the patient came through into the emergency room, and a stat CT scan was done of the back, and given her history, and this is what we found at that time. And this is the thoracic spine right here again for perspective. This is the front of the person, that's the back spinal process here. The spinal cord runs around here. Since this is a CT scan, it doesn't show the spinal cord as well, but clearly it shows the bone very well. And if you remember on the MRI, these vertebrae were actually very much so intact. Normal level, normal, good level here. But as you can see here, this is collapsed. This is at the level of about T2, T3 area. So it's completely about 60 to 70% collapse and destroyed with, I'm sure, abscess formation around this area if it's an MRI, but this is a CT scan, so it is it does not localize or at least visualize the abscess that well, but completely collapsed here, and so the patient was immediately transferred out to a tertiary center where the patient will then undergo surgical debridement, cleanup, stabilization, and a prolonged course of antibiotics. Well, thank you for joining. This is an unfortunate lady who, despite some antibiotic treatment, patient left against medical advice and then came back sometime later with a pretty profound worsening of her infections. And now she's paralyzed and recovering, but certainly that's unfortunate. These kind of infection are very serious, and even with the best of treatments, including IV antibiotics and surgical debridement, the outcome is at best just fair. But a lot of time the infection will progress, and if you allowed the infection to progress long enough, it will cause spinal cord compromise and paralysis, and significant disability can result. And so these infection needs to be taken seriously, particularly with multi-specialty teams, and the patient needs to definitely follow through with the recommendations. Otherwise, the outcome will be poor, including lifelong disability or even death. So hopefully you learned something today. If you have not subscribed, please do so, and we'll see you next time. Take care.